Over 11 years ago, I myself was a client. I was a client because my mom needed a kidney transplant. The normal reaction, and everybody had it, was, how could you possibly need to raise funds? Isn't it covered with insurance? Don't you have insurance that will cover this transplant? And the reality is yeah, the insurance covered the transplant. But in order to get the transplant, we needed to move and uproot our family closer to the hospital. We needed to be there, accessible, for 3 months at minimum. We needed to rent an apartment. We needed to make sure it was furnished. We needed to eat. And we needed to pay the copays and the deductibles. Nobody thinks about that with the high rate of health insurance, let alone the health insurance that we had to pay for. So we had to raise the dollars, and I found Help Hope Live. And we were lucky. We were lucky because they were tax-deductible contributions. We were lucky because Help Hope Live offered us this incredible opportunity to connect with a community when in fact that time of our lives we felt completely isolated. So this organization's been around for 35 years, and until my mother needed a kidney transplant, I didn't know about it. But it's 35 years of providing services during a period of time where it's desperately necessary. We also verify the medical condition for all of the patients that come to us, and we verify that there's a financial need. Until recently, the only people that really knew about us were social workers and hospitals and doctors. We're really trying our best now to get the word out.
The biggest misconception about Help Hope Live is that we are just a crowdfunding site, when in reality we're a national nonprofit providing one-on-one support to families and communities to help them raise funds through in-person events, online fundraising, social fundraising, to offset the uninsured medical costs they incur because of a transplant or a catastrophic injury or illness.
So oftentimes people who sustain a spinal cord injury often need to retrofit their homes, expand their doorways, expand their bathrooms, purchase new vans, purchase new equipment. We, last year, dispersed over $2 million across the country to make sure that people could retrofit their homes. Help Hope Live exists so that we could make sure that a medical crisis does not become a financial crisis. Very specifically, last year, $9.2 million went out to help people with their medical needs. It's because those medical needs are not covered by health insurance, because people who desperately need help the most are not receiving it from the coverage that they have. It involves community fundraising, it involves a community need, it involves other people stepping in to help.
So I've been with Help Hope Live for 12 years, and like the rest of our staff, I have a huge passion for our mission, which I think is what makes us so successful. We've been doing this for a long time, and it shows in the amount of money that we've raised, the support that we offer to patients and their families, and the healing that takes place in the communities because of our support.
We hope to reach everybody that is in need of our services. I not only believe in what we do here wholeheartedly, but I once used the service, which completely changed my life.